I'm Todd Neal of MedPage Today, reporting from the American Society of Hypertension meeting in New York. A head-to-head study pitted two diuretics, chlorthalidone and hydrochlorothiazide, against each other, both in combination with azilsartan, an investigational angiotensin receptor blocker. Takeda is developing a fixed-dose combination of azilsartan and chlorthalidone. Dr. George Bacris of the University of Chicago described the study.
We actually, not myself, but a group of us, convinced the company that they should be combining it with chlorthalidone rather than hydrochlorothiazide because it's just a better diuretic in the sense of efficacy and it has outcome data. So they listened to us and they did this study to actually show, was there really a difference? One of the arguments that's made for chlorthalidone being better is it's a better blood pressure lowering agent. And yet it's not more potent, it's simply got a longer half-life.
The study randomized patients with stage 2 hypertension to azilsartan combined with either chlorthalidone or hydrochlorothiazide. At both 6 weeks and 10 weeks, there were significantly greater reductions in blood pressure in the patients receiving chlorthalidone.
There's a clear advantage of as much as 6 millimeters in the first few weeks of getting the drug, and even at 2 months, there's an additional 4 to 5 millimeter difference. Now, you can say, well, that's not really a big deal. Well, if you're cooking at 175 to 180, and I've now got you to goal with one drug and I don't with the other, then theoretically I could sit down and calculate your higher risk at the relatively higher pressure, or you're going to need yet another drug to get you to goal.
Although chlorthalidone has been tested more in U.S. outcomes trials than hydrochlorothiazide, hydrochlorothiazide remains much more widely used in clinical practice. The investigational fixed-dose combination of azilsartan and chlorthalidone will provide clinicians with another choice of dual therapy, Bacris said.
There's now an ARB that seems to have the highest level of potency amongst ARBs, and it's married to a diuretic that you've heard about. It's been used in all the outcome trials in the U.S., except for 2, and has shown mortality benefit across the board, and it's now available in doses that you can use along with an ARB.
Barring any problems with the FDA review process, the fixed-dose combination should be available within 18 months, according to Bacris. From New York, I'm Todd Neal, MedPage Today.